Assalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay. Welcome back again with us, Mr. Iis Abdul Rojak and me, Yulistiawati. Now, in my second presentation, I will discuss about Unit 6, Hospitalizing and Simple Past Tense. For the first presenter, Mr. Iis, please.
Okay, unit
6.
when unit 6 hospitalizing. Nurse's responsibility and conversation, accepting a new patient, language focus, modals, practice playing a role, medical English vocabulary, reading a text. Next. Nurse's responsibility. Number one, observing the information of the new patient. Number two, introducing self. Number three, talking the patient to the room. Asking the patient change into pajamas. Setting the patient's identity ID. That's desolate. Explaining the patient how to use the nurse hall. Directing where the bathroom and other facilities are. Asking if the patient needs help and assistance. Telling the patient that the nurse will come back later. Next.
Okay. Next, conversation accepting a new patient. Me as a ER nurse and Felis and Mr. Iis. Me as VIP nurse and Felis, Mr. Iis, ER nurse and as Mr. Gomez. Felis is transferred from emergency room ER to VIP room by the ER nurse. The VIP nurse who is in charge in welcoming them.
Good morning.
Good morning. Is the new patient from ER? Mr. Is?
Good morning. Yes, she is. She is Felice. She is with her father, Mr. Gomez. She suffers typhus.
All right. Hello, Felis and Mr. Gomez. I'm Nurse Fallon. Welcome in VIP ward. We have prepared the room, included all the facilities. I hope you will feel comfortable, and if you need any help, I will be here to help you. Now, I will take you to room 3. Mr. Is?
I almost forget. This is the medical record. Please take care of her will.
Yes, of course. Let me see. The VIP nurse read the medical record. All right, Felix Gomez, 11 years old. That's right, nurse.
Well, no, I shall go back to my room, nurse, Mr. Gomez. Hopefully, your daughter will be better soon. And don't worry, the nurse will take care of your daughter well. Thank you, nurse. Yes, of course. I have no worry because I trust you all will take care of my daughter well.
Here is VIP 3 Felice and Mr. Gomez. Welcome. You may look around to know where everything is. Later, I will come back and ask you some question. Okay, Nurse, thanks. This is pajamas, Felice. Felice, you have to wear this. Okay, Nurse. Father, can you help me to wear this?
Yes, of course.
Well, I'll take the info set while you change her clothes. The nurse left to prepare the info set while Felice is helped by her father wears the pajamas. A few minutes later, the nurse come back with infusion set. All right, have you had your pajamas on? Yes, I have, nurse. All right. Now we'll apply the infusion, but before it, I will put on this bracelet on your right, on your the identity bracelet on your wrist. Okay, nurse. Okay, it's finished. Now, would you please lie down here? Yes, sure. Felice lies down on the bed. The nurse applies the infusion set. Okay, it's set. It is set. Hopefully, you feel comfortable here. We will try our best to give you a good treatment so you can get well soon.
Thank you, nurse.
No, no worries, sir. This is my duty to provide the best service for all customers in this hospital. Here's the nurse call. Just press the button if you need some help. Okay, nurse. There is a refrigerator on the left side on the corner, and there are TV set and conditioner.
Okay, nurse. By the way, where are the remote control for AC and TV set?
Oh, I'm sorry. Uh, over there on the right side. Do you need help? Please.
Don't worry, I will help her, nurse.
All right. Is there anything else you
No thanks. I will call you if I need help, nurse.
Okay, then I'll go back to my room. I'll be back here to check everything after your lunch. Okay. Don't don't hesitate don't hesitate to call me whenever you need help or assistance.
Okay, nurse. Thank you very much.
This is pajamas and ID bracelet worn by the new patient. This picture is pajamas and then ID bracelet. And just focus. Model. Basic model. I, you, he, she, it, we, you, and they. Plus can do it, could do it, had better do it, might do it, must do it, ought do it, shall do it, should do it, will do it, and would do it. Model do not take as final even when the subject is she, he, or it. Example, he can do it and he can't do it is false. Models are followed immediately by the simple form of a verb. Example, he can do it and he can to do it is false. He can does it is false. She can did it is false. Request with model. My, could, and can plus subject plus verb one. My and could are equally polite. Example, could you help me, nurse? Yes, of course, sir. Request with models. Would, will, plus subject, plus verb one. Example, would you take me to the nurse station? Yes, I would be happy to. Asking permission. Would you mind if I plus verb to or simple past tense? Example, would you mind if I close the door? No, that will be fine. And then asking someone to do something. Would you mind verb plus ing. Example, would you mind opening your sleeve? No, I'd be happy to. Medical English vocabulary. The example, word part of speech, allergy, allergic, antibiotic, antidepressant, bed sore, blood count, blood pressure, HIV, cardiopulmonary resuscitation, death, disease, emergency room, fever, heart attack, infection, injury, inflammation, operating room, physician, scrub up, shock, stable condition, wheelchair. Reading a text. The epiglottis. The epiglottis is a flexible flap at the superior and the larynx in the throat. It acts as a switch between the larynx and the esophagus, permit air to enter the airway to the lung and food to pass into the gastrointestinal tract. The epiglottis also protects the body from choking on food that would normally obstruct the airway. The epiglottis is a thin, lip-shaped structure at the superior border of the larynx or voice box. In its relaxation position, the epiglottis projects into the pharynx or throat and rests just posterior to the tongue. The epiglottis, the epiglottis, uh, sorry, the epiglottis is made of elastic with mucous membrane. Its anterior surface consists of non-keratinized stratified squamous epithelium that is consistent with the tissue of the mouth and pharynx. On the posterior surface, it is covered with pseudostratified columnar epithelium that is consistent with the tissues lining the pharynx. Under the epithelium layer is a thin layer of areolar connective tissue that provides a loose attachment for the epithelium and supplies it with blood vessels and nerve fiber. Simple past tense. The simple past tense is used to describe a complete activity that happened in the past. In other words, it started in the past and ended in the past. Verb consists of two, regular and irregular. The example for regular, verb 1, verb 2, verb 3. Verb 1-nya answered, answered, answered. Irregular, verb 1, verb 2, verb 3, it's same. Example, brush, brush, brush. Irregular, verb 1, verb 2, verb 3, it's not same. Awake, awoke, awoken. Simple past tense, affirmative or positive. The formulanya, Subject plus verb to plus object plus adjective adverb, or subject plus to be was or were plus adjective adverb. Example, they learned English yesterday. The book was on the table last night. Next is Mr.
Yeah. Simple past tense negative. Subject plus did not plus infinitive verb plus objective plus adjective or adverb. Subject plus to be was or were plus not plus adjective adverb. Example, they didn't learn English yesterday. The book was not on the table last night. Simple past tense interrogative. Did plus subject plus infinitive verb plus object plus adjective or adverb. To be to be-nya was or were plus subject plus adjective or adverb. Example, did they learn English yesterday? Was the book on the table last night? Next. Thank you.